Hi everybody, welcome to week 6. For week 5, I've already reviewed and scored quite a few of your assessments and physicals and care plans from that case study that was posted, and I think most of you are doing a really good job, so those are looking good. So this week, we're still in the assessment mode, and I think we've now beat to death the difference between a focused and a comprehensive assessment. Oh my goodness. So this week we're talking about spiritual assessment, right? So in our DQs, we are talking about asking patients about spiritual needs, performing spiritual assessment, that sort of thing. And then we're also talking about working with students in this area. And students who either are just one predominant faith. If you hear that strange sound in the background, that's actually a refrigerator squeaking. Don't worry about it. So if students are either a predominant faith or maybe they're not of a faith at all, maybe they're agnostic or atheist, they might have some struggles with how to do spiritual assessment with patients. So we'll be talking about that kind of whole realm in our discussion questions. So we've got another assignment. This one's a bit more straightforward. Remember, you've got to look at the directions and the rubric. So you're going to analyze at least 2 spiritual assessment tools, okay? There's a ton out there, so I don't think you'll have any trouble finding at least 2. The couple points to remember, you have to include at least 4 references, and none of them can be your textbook, okay? So you got to look at some outside articles and sources. And the rubric talks about looking at validity and reliability, okay? So when you have any type of tool, the validity, is it measuring what it's supposed to measure, okay? If I'm measuring a student's IQ, I'm supposed to be measuring their IQ, not how well do they know a particular dialect slang that might be part of the questions. Okay, so that's validity. Is it measuring what it's supposed to? Reliability, is it consistent? Every time that tool is used, is it consistent in giving you measurements of that same thing? And usually, if you look up a professional article, a nursing article, a psych article, something, but a professional article in a professional journal, you're going to find research about those two things, and it's going to mention validity and reliability when it's talking about the tool. So hopefully you'll be able to find that. And then there is a little section in the rubric, how would you use these spiritual assessment tools during a health assessment? So there's a little bit of extra piece that goes along with that. Okay, so look at the directions, look at the rubric, make sure you're including everything in both. And we had some good discussion that last week. Thank you for, I think last week I posted the art assessment assignment. So thank you for those who responded to that. It's just an interesting way to think outside the box when we're teaching. Whether we're teaching students or new staff in a clinical setting, something like that, we need to make sure that our students are really engaged and that we're not just standing up, clicking the PowerPoint, reading word for word. We need to think about these different types of learning possibilities. We need to be a little creative. Okay. All right, so 2 discussion questions and an assignment. And if you have any questions, please post them in the individual forum or questions to the instruction forum. And I will get to those as soon as I can. Still having a really nice time in Hawaii. I'll be home on the weekend. And I'll see you in the main forum.